when it comes to you having sickle cell pain, there's really nothing that we as family, friends, caregiver, or whatever, you really can't do anything.
Welcome to Sickle Cell Sundays. We have our first guest. This is my cousin Florence,
Hello.
Also my emergency contact. Would you consider yourself my caregiver as well?
Yeah.
Okay, cool, because our questions are based on that. Okay, so the first question would be, can you describe your first experience of seeing me go through a sickle cell crisis and what that was like for you emotionally?
Okay. I'm gonna go 2.
Okay.
The first time I saw you had sickle cell crisis, I think we had went to Oakland or something. We went to get furniture in Oakland. It was me, you, and some other person. And I was driving, you were in the back, you got your stuff, you were in the back, and you and the other person were in the back. And I think you started to have like sickle cell pain. I didn't know what was going on, because even though we grew up together, I feel like because you were always in the hospital, and I lived in San Jose at the time, I didn't really get a chance to really see that.
Right.
So at first I was like, what's going on? And the other person was like, I got this, I know what's going on, you know. So we went home. You didn't go to the hospital, but you know, that person calmed you down. That was my first time really seeing it. The second time, I think we were home in the first apartment.
Okay.
And it was just a regular day, like it always is. And I think like overnight, you just started to have pain, and it was one of the scariest things I've ever experienced, because I didn't know what to do. Mm-hmm. And I was just like, how can I help? Like, what do you need me to do? And of course, you were giving me tips and what you needed, and I think we did end up taking you to not St. Joseph, but Children's Hospital in downtown, and yeah, it was scary.
Yeah. Do you feel like that experience, or just overall your experience as a caregiver, has changed your perspective on, let's say, like life or health?
I would say yes. So I would say the experience that first time was the first time. That's like the one time I just needed it. I think it kind of prepared me for like future crisis.
Yeah.
So, you know, I knew what to do. I wasn't so like shook as I was the first or second time. Mm-hmm. Yeah. And it also made me like see the hospital in a whole different way.
Light, yeah.
In a different light. Just like, because you know, you go to the hospital. I go to the hospital. I just go to see my primary caregiver, and I go home. But that was my first time in the emergency room. Mm-hmm. Actually, no, never mind. It wasn't my first time in the emergency room, but like it was my first time actually sleeping in the emergency room. Yeah. And it definitely changed my perspective on several things. The first thing would be just patient care.
Yeah.
How to advocate for somebody in the hospital in that setting, and just like the urgency of how things, like I feel like when we go to the hospital, things should just, everybody needs to move, you know, to get you the care that you need. Right. So I definitely think it changed my perspective on how the hospital, or especially like the ER, is ran. And health-wise, I think if you have been like a healthy person all of your life, you're not really like aware of people who are going through something, who have like diseases, immune diseases, or like cancer or anything. You don't really realize like how blessed you are, right? Because
talk about it.
Because you're going all your life, like I said, I only go to the hospital when I have to see my primary caregiver. Right. So taking care of you has definitely just, you know, because I want to be careful what I say. I don't want to say, you know, oh my God, thank God. But you know, it definitely,
it's a blessing though, to be healthy.
Yeah, it definitely allows you to really give glory to God for health and for life as well. You kind of just are more aware of the way that you speak to yourself health-wise, right? Like you can be like, oh my God, this is going on. But I have a cousin who has sickle cell, and I'm just like, you know,
push through.
Yeah, exactly.
That makes sense. You talked about how like your experience has had you, develop a sense of advocacy, like when we're in the hospital or ER setting. What do you feel like is your biggest strength in those settings in order for things to operate smoothly? No, that's very true, because closed mouths don't get fed, especially not in the ER.
I think when one of the experiences that we had in the hospital was when we went to LA. We were here in LA. We were in college at the time, and we came for something. We came for something, and we ended up having a crisis. And we went to the ER as always, and we were just sitting there. And sitting there. And it got to a point where I got to the wait. It wasn't the waiting room, but like
the triage area.
Yeah.
Okay.
And where all the nurses were. And I remember I had went to one of the nurses like, hey, so she has sickle cell. We've been here for a while. Where is the doctor?
Right.
And they're like, oh, the doctor's coming. And another 30 minutes went by, and I just remember going in the middle and just talking really loud so they can hear me.
Yeah.
Like, so we're just gonna be sitting here, and you have a patient that's clearly in pain. You're not gonna do anything. And I remember the nurses kept looking at me, and one of them got up and was like, what's going on? I was like, what's going on is we have been here for over an hour. You have a patient who is clearly in pain, and you're all moving slowly.
Yeah.
So speaking of
that, very true.
You have to.
I guess that kind of brings me to the next question, which you kind of already answered, but like, what other struggles have you faced as from a caregiver standpoint in the hospital? Like, of course, that delay in waiting, but what else would you say would be a struggle that caregivers may see in those settings?
The patient.
The shade.
So I know Lupe very well, but she can get so mean.
Sometimes.
No, you're way better now, but when we were in school, oh my God. And at this point, like, we were maybe 22, 23, 24. And I just remember every time we took her to the hospital and the nurses would ask her questions, like trying to check her in, she would respond like they should already know. Like, they should already know, what the answers to her question. And I do understand it because she's in a lot of pain. So it's kind of like sometimes the question that they're asking her is reductive. And on their perspective, they're just trying to check her in.
Right.
And I'm always sitting here like, Lupe, please answer this question. And I remember there was a time, it was me and her, and I took her to the hospital, and we encountered a black nurse. She was not having it with her. She was like, I'm trying to help you out.
Was this DC?
No, it was Oakland Children's Hospital.
Okay.
Oakland. She was not having it with you. She was like, I'm trying to help you out here. But from there, I will say that I started to just collect that information from you. And so when we go to the hospital, I would just answer the question. I would check her in. I would tell them everything that they needed. I had all her insurance cards, her ID cards, any questions they had, I would always answer it so she didn't have to answer. And because they're always looking at her like,
yeah.
Girl.
And then it makes like all the difference, because like from the patient perspective, you're just tired, you're in pain, like stop asking me questions, even though like from the nursing perspective, we need to assess you. It's just hard to have to deal with all of those things. And it's like, figure it out. Like, especially some of the questions that they ask is like, okay, that one you should absolutely already know.
True.
But it makes all the difference when you're not alone and somebody is there helping you answer those questions. Which is why you're my emergency contact.
I used to be like, okay, just answer these people, please, so we can move forward. But
how would you say you balance like your life and your mental health as well as being able to be present for me?
Okay, so I will say one thing that really helped, or at first I wasn't balancing it because in school, remember I used to work in Oakland, and thankfully her hospital, which was Children's Hospital Oakland, used to be about 10 minutes from my job. in downtown Oakland. So sometimes when I would take you to the hospital, I would go back home and then come back to Marvin's to work. And at first it was okay, like, you know, but my boss at the time was very like, what are you doing? Like, why are you not coming to school, to work early? And I used to be like, well, that's my cousin, so, you know. It was a lot, to be honest, because when it comes to you having sickle cell pain, there's really nothing that we as family, friends, caregiver, or whatever, you really can't do anything. You can do your best to make sure that your loved one is comfortable, but you can't really do much to help their pain, because that's something that medication has to do. Right. And I think the hardest part is always watching you go through that. So I will say that I remember there was a time during COVID, you came home for the entire time, and you had a crisis. And it was like 3 o'clock in the morning. And I had to take you to the hospital. You couldn't walk. That was actually my first time, because I've always heard when you were in Philly, you had crises where you couldn't walk, but that was my first time ever seeing you have a crisis where you needed a wheelchair. And I remember I had taken her, like, I barely parked the car. I ran inside the hospital, like, I need a wheelchair, whatever, you know, a lot was going on. And I remember they were getting you on the wheelchair, and I was so I wanted to cry. I was crying, but I was so emotional. I didn't want her to see it. And because it looked so debilitating. You know, and there's nothing that I could do to help that pain. And what made it also worse was it was during COVID. So when I checked her in, the nurse was like, you have to go home. And I kept standing there, and she was like, we're gonna take care of her, everything's gonna be okay. And she was like, you have to go home. And I could still hear you, because they had taken you to the room to check you in. And I was like, can I stay? And they were like, no, you can't go, you can't stay, you have to go home. So that was really tough, because I was always used to being in the hospital with you, just sitting there and just watching everything going on. So to go home for hours and not, you know what's going on, because you could barely even use the phone. So so sometimes it's really hard to watch that.
Oh, I never knew that, but that day definitely was intense. I think also the pressure of like being COVID, like I used to like not want to go to the ER when I had a crisis during COVID. So the next question would be, I guess, what would you say is like the most important thing that you've learned through your experience with me or your journey this far, like being a caregiver, or like just in learning about sickle cell and all that we've gone through?
Shout out to all the caregivers out there, because it is not easy. When I came, I don't know if it was October.
It was recently.
And you had just gotten out of the hospital, and I came after you came back from the hospital. But I was at Nicole. I was at my best friend's house. And good thing I drove. You had been having issues. Like, although you were discharged at home, you were kind of having problems with like the bladder thing, where you had to like go a lot because of the fluids. So I was just like, oh, you know, I'm just gonna go over there and just help her out for the day.
Wasn't just a day.
It wasn't just a day. She had to go a lot, and she couldn't walk either. So it was like every 10.
It was like every 15, 30 minutes. At least for the first like 5 hours, like that before I went to sleep. Oh well. It was all through through the night. But then eventually I did go to sleep. But majority of the night I had to use the bathroom like back to back and couldn't walk, and it was like, bruh.
So she had to use the bathroom very frequently. So I had to help her, and Lupe is taller than me, so.
I'm 5'8".
I'm 5'3".
So you guys get the picture.
So it's like, you know, but she just had to use the restroom a lot. And I had to walk her from the bed into the restroom. out in, and because she couldn't walk, it was kind of hard for the balance as well.
Yeah.
So we did that the whole night through. From I think I came at 2 p.m. on Saturday, just guessing, and then that went on all through the night until Sunday morning.
Sunday, yeah.
And I wasn't sleeping.
I felt so bad.
It's okay. So
you even slept on you laid on the couch. Like you even stayed alert.
One thing that she probably doesn't know, I'm a light sleeper anyway, but whenever we're together, I don't sleep. Like,
dang.
I don't sleep because one experience that we had was when we were in DC for the 4th of July, and we were like four of us, and we were all in a room together. And everybody
in the hospital room? In the hotel room? Sam's room. Ooh, yes, I remember.
Sam's room. We were all sleeping. And I heard someone. and like I mentioned, like whenever I'm around her, I'm a very light sleeper. So I heard her in pain while she was sleeping. But she was sleeping, so she didn't know.
Yeah.
That she was in pain, so she was basically having a crisis in her sleep. So I was up. I was like, "What's going on?"
Right.
Like, So from that experience, whenever we're together, like I sleep, but like I'm more aware of the surroundings. Like if I hear a stir or movement, I'm always like, "Are you okay? What's
not
going
in that
on?"
last REM state.
Yeah, I'm just more like aware.
Yeah.
I would say like if we're together, I'm just more aware of what you're going through, and even if it's not a pain, if I hear you moving, I'm just always like,
what's going on?
Are you okay?
Yeah.
What's going on?
And I remember that night was pretty crazy because, like she said, I was asleep and then I woke up and was in pain, and she was like, "Yeah, I was watching you have a crisis in your sleep," and I was like, "What the heck?"
Yeah.
But it ended beautifully because we went to the hospital and the nurse was Black, and she let my cousin, my friend Adrian. It was like 4 of us that got to stay in the hospital room, like slept there. Yeah, it was a ball. Yeah. It was like a fun hospital stay because it was like a sleepover, but at the hospital.
Yeah.
I guess that brings me to my final question, which would be, it's a big one. If you could change one thing about the healthcare system to better support sickle cell disease patients and caregivers, what would it be?
I would say that they should listen to them more. I think that you shouldn't have to have a caregiver or somebody in the hospital with you to advocate for you. And unfortunately, that's the case because sometimes you'll be in the hospital and the nurses are just kind of like, indifferent. And I kind of wish that's something that would change. Like I get it because they've seen so much, but I kind of wish they would just be a little bit more cautious, a little bit more empathetic towards their sickle cell patients and all patients in general, really.
Right.
That they would move, and I know because of the ER, the way that it is, just more efficiency in response. Because when it comes to sickle cell and the pain, every time. Each passing moment matters. Like it's a timing thing, and if a sickle cell patient comes to the hospital at a 6, you want to respond immediately so you can bring it down. Because once they pass that threshold, it's a lot more.
It's harder.
It's harder to control and bring that pain down back to like the middle ground. So I wish they would do that. We've come across so many different doctors and nurses, and some are better than others, but I definitely would hope that more, at least even in education as well, like it's not just like a blurb and like a passage in the textbook, and I wish it would have its own like chapter so that there's more like education, because I think that's what it is. There just seems to be more education about it, because sometimes you'll come across a doctor that's like, "Oh, I've never
heard of it or seen it,"
and it's like, yeah.
I completely agree with you. That's a great answer. Do you feel like that there's anything that I haven't asked you that you would like to share, you feel will be beneficial to those that will be listening or watching? Yeah.
I don't know.
Yeah.
I think a lot of people should research sickle cell, especially a lot of Black people. Just with everything else, it just affects us a lot more than other races. And that's not to say you don't have other races who do suffer from the disease. They are, but as Black people, I do think that we should be more knowledgeable on diseases that affect us as a race as a whole, because that helps us not only for awareness, but also in a way decreasing the potential of future kids having sickle cell. You're just more aware of your blood type and your partners. I think that if we do the bare minimum in just finding out
if we're carriers of the trait,
if we carry the trait, what the blood types of our partner is, it would help us make better decisions when we procreate.
Right, so people don't have to live the life I live.
Yeah, it's very real, you know. So one thing that I have, I want to call it, like, it's not selfishness, you know, but I will say that just think about what you want your kids, how you want your kids to live this life.
The quality of life.
The quality of life, because even as a parent, if you do have a child that has sickle cell, you're not always going to be here to take care of them.
That's very real. Thank you for that.
You're welcome.
It's been a pleasure interviewing you.
Really a pleasure.
Thank you for joining us on Sickle Cell Sundays.
You're welcome.
That's the end of this episode. Tune in, like, subscribe, comment, share. Yeah.
Yeah.
Yay! No, you did a good job.